Okay. Welcome to Sports Talk. I'm Matthew Kelly, and today we're going to talk about patella dislocations. Today I'm joined with Mason Nijelski, projected overall first-round draft pick in next year's NHL draft, and he has personally sustained 5 patella dislocations. So he's here to talk with us a little bit about that. Now, Mason, can you just at least tell us what is a patella dislocation?
Yeah, Matt, I can. From my understanding, it's when your patella or kneecap, as I know it, slips out of your trochlear groove. It usually happens laterally, all 5 times for me. It's slipped out laterally.
Wow, okay, so it goes laterally, and 5 times. Wow, that's impressive. So why do you say dislocates laterally?
Well, from what I know too, the doctors have told me that your lateral quad is stronger than your medial quad, so it will pull on that when you get a extensive force on it.
So a bit of an imbalance there?
Yeah, muscle imbalance basically.
Oh, okay, so that's a contributing factor. And when would this happen? Like, what would be a mechanism of injury, would you say?
2 of the 5 times for me, my skates really dug into the ice, caught a groove or something, and I've twisted and it's popped out. And then 3 out of the other 3 times, I've been crunched pretty good, head down, trying to toe drag, and hit from the side, and she slips right out.
She just slips right out. So just to summarize that, legs get kind of twisted, one of the legs, maybe gets hit on the knee, valgus force, strong quad contraction, pulls out the patella. Sound about right?
Yeah, that sounds basically
about it. Okay, and then so you've been injured quite a bit.
A few times.
Could you kind of tell us what kind of signs and symptoms you've experienced and how you knew it was out of place?
Well, it happens really quick. From what I can remember, I went into shock right away. But from what I can remember, you can feel it slip out right away. Really, really, really painful. Sometimes it'll pop right back in, but then when it stays out, you know what's happened.
Okay, so you basically feel it go out, and lots of instability with your leg there.
Yeah. Okay. You can't stand up or do anything. You just kind of lay there.
Okay, perfect. And so when this has happened in the past, what kind of care did you receive as you were on the ice, or emergency care, I should say?
Really, I didn't receive any care. Kind of laid there, waited for the trainers to come. By the time they got there, I put it back in myself, and they just kind of helped me off the ice. That was about it.
Well, that's not good. So luckily, we've got via satellite expert on this subject of patella dislocations and what you should do for emergency care and emergency treatment as you move forward. So we'll just cut to her. Colleen Daniels, how you doing?
Very good, thank you. So Matt, the training staff really dropped the ball not having an emergency action plan prepared in advance. What should have happened is an immediate assessment on the ice. Mason would have probably reported feeling his knee give way or hearing a pop. Next, we would have gotten Mason off of the ice with the help of our trainers so that he does not bear any weight on his injured leg and further aggravate his injury. After we get Mason off the ice and remove the equipment providing support under the knee, we will be able to clearly see the patella displaced, as well as swelling, effusion, and tenderness along the medial edge of the patella. It is also important that we take a distal pulse after the injury assessment. And then we want to immobilize the knee, and we're going to do this by providing a posterior knee splint. And we're also going to apply ice and transport Mason to the emergency room where he can be further assessed by a physician. During the acute phase, post-patellar reduction, we want to have the knee immobilized as well, and we're going to do this by using a posterior knee splint for 1 to 3 weeks. We also can provide Mason with a neoprene sleeve, which can provide compression, and a knee stabilizing brace to wear throughout the day. It is also important that we continue icing and elevation, and we're going to do this for 10 to 15 minutes 4 times daily. After that, we may also provide Mason with some anti-inflammatory medication for the first few days to deal with the pain, and we're going to start strengthening the quad muscle, in particular the vastus medialis oblique, which is the most important muscle in stabilizing the patella. After swelling and bruising have resolved, Mason is in the recovery phase, and he is going to progress through a treatment and exercise program where he's going to work on developing a full range of motion, especially knee flexion, so that he may get back onto the ice in about 4 to 6 weeks. Back to you, Matt.
Okay. Thanks, Colleen. And we're now back here with Mason Nijelski. So Mason, I can see you're back on the ice and back playing. Can you just take me through what steps it took you to get there and maybe what steps you're taking to still prevent another injury from happening?
Well, Matt, rehab and prevention are really similar. It's what my physiotherapist told me. She broke down my exercises into 3 phases. Phase 1, really reestablished my active pain-free range of motion. A little bit of muscle endurance. That lasted about, 2 weeks, I would say.
Okay.
Maybe 3 weeks. Kind of was composed of like heel slides, straight leg raises, little simple stuff like that.
Cool.
Phase 2 was the next couple weeks. Essentially, it was just to regain my muscular strength because I had been active for too long. That was composed of body weight squats, no body weight stuff, some lunges. And then phase 3 was really working on unilateral exercises, getting my legs prepared to get back on the ice. That was more step ups, single leg deadlifts, more stuff like that. Really getting me ready to get back on the ice.
Okay, so getting you ready to get back on the ice and then still doing those exercises as you're moving forward to the season here?
Yeah, that's basically phase 3 can be continued into your maintenance phase. So hopefully I can keep doing that so I don't get hurt again.
Yeah, for sure, and hopefully you have an excellent first NHL season. Thanks for joining us, Mason Nijelski. And unfortunately, that's all the time we have today. So that's Sports Talk with Matthew Kelly. I'll see you next time.